Hello everyone, this is Mesam Ali and this is my progress report for my second semester of the first year of my master degree. I am a student of the Department of Life Sciences. The name of my advisor is respected Professor and Director Sai, and my co-advisor name is Professor Shi from the Department of Life Sciences. This is the checklist. I review my progress report from my respected Professor Dr. Sai. The name of my research topic is antimicrobial effect of far-UVC to 2 nanometer light therapy in the rat corneal model. This is my timeline from February up to now. What I did in this duration. This is in this slide I explained that. This is my academic current progress. I took 7 subjects for my this second semester, in which 5 subjects are compulsory for scholarship, and below this is bench work which I learned in my this semester study. Bacteria cell culture, H&E and UVC 222 nanometer exposure principle and use, cornea aerobic bacterial sterilization test and cryosectioning by the machine of with a cryostat. This is the summary. As we know about bacterial keratitis and fungal keratitis, one of the severe eye infection. If it not treated on a time, maybe it cause vision loss. So this time is a challenge for the ophthalmologist to find the safe and easy way to treat that type of diseases with far UVC to 2 nanometer light. Current way for treatment is using only antibiotic eye drops, which is so painful and cause inflammation. Even there are some dosage which are so time long lasting, like for fungal keratitis is maybe some diseases related with fungal keratitis is up to 6 months. The patient use eye drops. Maybe it also cause a vision loss if we use more antibiotics in the form of a fluid or liquid. So the summary of this current study is to find the easy and non-infected way to treat that type of diseases with the effect of UVC to 2 nanometer radiation. This is the UVC to 2 nanometer light therapy. As you know about UVC to 2 nanometer light therapy is one of the safe and effective light therapy which kill different type of microorganism on the layer of a skin. It only penetrated to the microbial layer due to its range is too short. Here from this picture we can easily get the idea. If you use a 2 to 2 nanometer light, it will only penetrate to the first layers of the skin. Same in a cornea, it will only penetrate to the first layer of the cornea. Here in this picture we can see corneal anatomy. Cornea have 5 layers: epithelium, Bowman's layer, stroma, descending membrane and endothelium. And to the right side there is an anatomy of epithelium picture. Here we can see the range between 200 nanometer to 290 nanometer. It only penetrates to the first layers of the epithelium, sublayers of the epithelium, that is stratum corneum and epidermis. This is the another important point about this topic. Microflora, as we know about, is a term which is used. It is a community of bacteria which exist on inside of the body, but before surgery we did disinfect all the eye with the iodine, but it's so painful. The doctor used it for 3 minutes in the whole eye. So our first hypothesis for that of microflora is UVC to 2 nanometer can be effective substitute for iodine in corneal sectioning sterilization during surgery. And this is about bacterial keratitis is also it is the infection of the cornea. So mostly causes of bacterial keratitis is only due to one of the bacteria, Pseudomonas aeruginosa. So our second hypothesis is UVC to 2 nanometer can be effective in initial stages to kill bacteria in bacterial keratitis model. This is microbial keratitis, fungal keratitis. So in this we can see in fungal keratitis it's also infection of the cornea, but we should know about in fungal keratitis it should be know like we can use that type of lights in early stages, otherwise vision can lose and the rays cannot penetrate it to kill that type of fungus in the cornea of the fungal keratitis patient, because in some cases treatment cannot restore vision. This is the benefits of using UVC to 2 nanometer radiation light to kill bacteria and fungi. This is our research aims about this my topic. Like we will we want to get successful results. about that points, and we know about the exact time exposure of the UVC 222 nanometer. Current progress result data. This is my current progress report result data. In this picture we can see, as we know about the fluorescent sodium is a staining technique which is used for the corneal staining, which visualize the damaged epithelial cells by installation of sodium fluorescence, is the most reliable clinical way to assess corneal integrity. If our cornea have some lesions, so the lesion area is bigger, so that kind of fluorescence green signal will be there. So in this picture I did not get the good image anyway, but because of monitor is not so good here in this picture, in the have the some contrast problem, but at last I got a little bit. Here we can see at 0 second, 1 second, 5 second, 10 second, 15 second and 20 seconds. So this is the first result. This is the second result, tunnel assay to evaluate safety of UV 222 nanometer by measuring apoptotic corneal epithelial cells. We exposed UV light to the cornea epithelial cells. We want to measure the apoptotic cornea epithelial cells of the rats, so we exposed by different points: 0 second, 1 second, 5 second, 10 second, 15 seconds and 20 seconds. So here we see up to 5 seconds there is no tunnel positive cell signaling is coming, because it's up to 5 it is safe. Later at 10 second, 15 second, 20 seconds it created some we got it some tunnel positive cells. Here we see on 10 second and 15 second, 20 second it scratches and the cells detached from the cornea layers. So this is due to if we give more UVC time exposure, so it affect the cornea first layer. So this is the result of immunoblot to confirm the apoptosis in the cornea cell at different time point. As we know about from this picture, we can see only at 10 second collected a lot of only on 10 second we can see that we collected a lot of the damage is minor, so still have a lot of apoptotic cells can attach on the cornea. But we expose more than 15 second, apoptotic cells fully dies and they detach from the cornea epithelial cells. So we don't have apoptotic cells and did not collect enough apoptotic protein. The signals mean that it is damaged. Here we can see up to 10 second is okay, but 15 second and 20 second this apoptotic proteins we cannot see the strong signal. That is the problem. We exposed too long and the cell already died and detached from the cornea. We cannot collect collect the sample. That is the reason. So 1 second, 2 second and 5 second is clear, having no problem, but after longer time it is damaged. Same here in this picture I also explain you. In this tunnel assay we can get like in this result we can see only the first layer of the cornea epithelium is okay up to 5 seconds, but later the first layer have created some dyes. So this is the another result which I got it from after cornea aerobic bacterial sterilization test. In this result we got it the swab after your exposure of UVC up to different time exposure points, 1 second, 2 second, 4 second. Even we can also use in this study iodine rat model. So we are here we can see like with the sequence if we can see. So we got it after exposure first 1 second we got a 19 CFU. In 2 second we got 9 CFU. In 4 second we got 3 CFU. With the sequence if we see, so it decreasing with the passage of time. So it's mean that if we use exposure of UVC for more time we can easily get the data like the microorganism will be die on the cornea layer. So this is my future study. As earlier I explained about that in my this study I will work on two models. One is bacterial keratitis model and another is fungal keratitis model. And so this is the study design for bacterial keratitis. In this we have three groups: normal groups, positive control and UV treatment group. So we will check and compare their results. And this is the fungal keratitis result. This is the fungal keratitis model on which I will work. But in this for fungal keratitis model, I selected only the first corneal scratch model because uh, we just want to follow the corneal scratch model because it's safe and it's effective for after uh, fungal inoculum. We can easily kill that type of fungi with the UVC 2 to 2 nanometer exposure because it penetrated to the first layer of the epithelium. If we use the another B and C, maybe it will create some problems. So therefore we selected only corneal scratch model. So thank you for all of you of the audience and committee, and for my respected professor Dr. Sai, and for my co-advisor Professor Shi. Thank you for all of you. Thank you.